Forming a strong attachment to parents and caregivers is essential for any young children's emotional, physical, and psychological well-being. It allows them to develop self-esteem and gives them a strong foundation to build healthy relationships later in life. However, when faced with a sudden loss of their secure base, children may experience what is known as abandonment issues, and this can cause a lot of issues in further relationships. So first off, what is fear of abandonment? Fear of abandonment is a form of anxiety that a child or an adult experiences when they're faced with the idea of losing someone that they care about. This fear comes from a person's past experience that has led them to believe they could not rely on others. Abandonment issues usually emerge in childhood following a traumatic loss, and as a result, a child may develop a fear of losing other important people in their lives. Some children will continue to fear abandonment as they grow up, even into adulthood. And although it's less common, abandonment issues can also begin in adulthood. These may be reactions to sudden loss, such as a partner leaving or passing away. Some people actually are at a higher risk than others when it comes to suffering from abandonment issues. Individuals who have been neglected or abused as children, sustained a serious injury, or have been victims of a crime are much more likely to develop abandonment-related fears. I also want to note that abandonment issues are also often linked to borderline personality disorder, a condition characterized by an intense fear of abandonment. The combination of an overwhelming fear of being left alone and being overly sensitive and emotional leads people with BPD to see threatening signs of abandonment everywhere. As I continue into this video, I want to talk about what causes abandonment issues. Fear of abandonment is often caused by events that compromise a person's physical or their emotional security. It makes them wonder if the things lower down on Maslow's hierarchy of needs are actually being taken care of, and if they'll be taken care of in the future. For example, death of a loved one creates an emotional void that the person will try to fill, sometimes with fear. Physical or mental abuse may cause mental health issues and a fear of abandonment. Also, poverty may give rise to a fear that emotional resources such as love, attention, and friendship are also limited. It's also worth noting that relationship loss, including divorce and infidelity, may result in lingering abandonment fears. It's important to keep in mind that not everyone develops a fear of abandonment as a consequence of experiencing a loss. As with other forms of anxiety, several additional factors may play a role in developing these issues, such as the level of emotional support that a child receives, genetic predisposition, environmental factors, stress, and even just simple brain chemistry. So I'm going to run through a really quick list of abandonment issue symptoms. Inability to trust others, pushing others away in order to avoid rejection, feeling insecure in any relationship, developing codependency, the need to control others, the need for constant reassurance that others will not leave, inability to sustain relationships, and in more severe cases, people with abandonment issues will develop unhealthy ways of coping with their fears, such as addictions, eating disorder, and even self-harm. Now, I also want to talk a little bit about the types of treatment for abandonment issues, because if left untreated, abandonment issues can have a pervasive impact. They may negatively affect any intimate, social, or professional relationships that a person forms later in their life, and impair their ability to trust others. This may cause people to constantly fear that they will be abandoned again. Individuals with low self-esteem may seek refuge in dysfunctional relationships that reinforce their belief that they will be left alone. And in addition, people who have experienced abandonment are more likely to suffer from anxiety, depression, and long-term mental health issues. So understanding the fear and its origins is the first step towards resolving abandonment issues. And the first tip I have for you guys is basically self-care. Mild cases of abandonment fears can be treated by simply addressing their source and learning helpful behaviors and coping strategies, such as acknowledging any past abandonment trauma. For example, just being self-aware about it helps a lot. Other things that help is practicing mindfulness, attending a support group, and for many people, the fear of abandonment is so deeply rooted that it is not possible to deal with it alone. And in this case, it's necessary to seek out the help of a mental health specialist who actually has the tools and knowledge to help someone overcome it. Therapists work with patients on understanding the origin of the fears they have and establishing strategies that they can use whenever the fear resurfaces. Therapy can also help people with abandonment issues make a distinction between their vulnerable past self and the confident person that they want to become. There's also several different types of therapies that are used in dealing with abandonment issues. I'm going to go through a few of them here. The first one is called eye movement desensitization and reprocessing, which is commonly referred to as EMDR, and it's a type of psychotherapy used in treating traumas, including those caused by abandonment. EMDR may help reduce symptoms of abandonment fears by reprocessing painful memories and diverting attention from their emotional consequences. Secondly, we have something called dialectical behavior therapy. Dialectical behavior therapy consists of mindfulness and emotional regulation training, either in a one-to-one therapy or in a group setting. People with abandonment issues learn how to manage their emotions and to better communicate with their partner about their abandonment issues and fears. Third, we have cognitive behavioral therapy. CBT often helps increase consciousness of feelings about an event that has caused the fear in the first place. It's about understanding yourself, and it allows patients to change their perspective of whatever that event was and restructure the way that they think about it, their perspectives and their thoughts to reflect current circumstances. And lastly, we have something called psychodynamic therapy. Psychodynamic therapy helps identify thoughts and emotions that are causing the fear, the root cause. And through this type of therapy, patients can get a better understanding of the defense mechanisms they have created due to the abandonment and how they influence their relationships with others. I hope that this video on abandonment issues helps someone out there, and if you have any questions at all, feel free to leave a comment below. Thanks for watching, and I hope to see you in the next video.